what's going on there on page 282? What you learned that already. What's it called? Anterior posterior drawer test. Okay, and basically they're just doing a posterior and anterior glide, and you could do that with somebody. I don't necessarily do that as a mobilization, but you could. But I'm not going to make you responsible. But that's what's going on there, so you know what's going on in 282. Now on page 283, that's where we want to kind of start picking up with things. So let's look at figure 66C, okay? So the person, again, is in this position on this table like that, and let's bring this up just a little, bit, slide your butt over a little bit, yeah. And let's get your leg out like this, good. All right, so you'll notice, bless you, on 66C, same position as we just had with the belt, but Freddie's standing on the outside, or the lateral side of the leg, okay? Now, a long, long time ago, when he first showed, like in my very first little mobilization book that Freddie put out, he did not differentiate between pushing on the medial and lateral sides of the leg. He never did. He just said, get him in this position, come in here, put him in the restricted position, get your hand set up, and then just do a glide in a dorsal direction. That was basically all you did, okay? But now what he's done is he said, okay, well, I'm going to bring this up a little bit. He said, you know what, let's think about this. And it's not a bad idea, and I've done this from time to time. I still go back and just do a straight posterior glide often though too. But when you flex your knee, right, your knee not only moves in the sagittal plane, but you also have what? Transverse motion, right? So you can flex and medially rotate your tibia, flex and laterally rotate your tibia. And from time to time, you'll see patients that when you're trying to work on knee flexion, they say, I'm having a hard time flexing my knee, but you know what? It's binding, or it feels like it's binding on the medial side of my knee. It hurts like here, back here. And you wonder if is there some preferential capsular tightness on the medial side or the lateral side. I don't know. It could be. It might be worth a try to give it a go and see if it makes a difference for him. So that's what he's doing here. He's trying to talk about not only working in the sagittal plane, but then working at on the transverse plane. So what he does for this first one, he stands on the outside, gets his hand here. What do you think this hand's going to do? Well, it's going to do two things. All right, if we want to push on the medial side of the leg, it's going to want to turn the tibia what? Medially. So we could pre-position the tibia if we want to, which is not a bad idea. You could just do some slight medial rotation. Take your hand, instead of going right on the tibial tuberosity, you come over this medial side right here. Okay, and then this hand also does another thing. It tractions. Light traction. Because that separates those joint surfaces. Try to get your forearm perpendicular, and then you're going to be pushing posteriorly with a little bit of force, more force on the medial side. Okay? What do you think he does for the lateral? Slide this way. This other leg over, slide over here. Okay, so he does this, right? A little bit of lateral rotation. Everything's the same, and this hand goes where? More on the lateral side. A little bit of traction, and then you get your glide. Okay? Key things are, when you do this mobilization, you're going to have to move with the patient. So you may start with someone up here, but then watch my form, how it has to change in its angulation. When I get to a certain point, what do I got to do? Start moving the table up, right? And in some cases, you may have to change your body position in such a way that you can get your hand in arm in a better position. Okay? So you have to adapt. So he just shows you that starting position in that neutral flex position. Yes?
On the one with the lateral side, you're rotating the tibia in the external rotation, correct?
That's my goal, yeah.
Thank you.
Yep. Yes?
On the same one where you're laterally rotating the tibia, where exactly is your hand placed?
Okay, so here would be the tibial tuberosity. So the old-timey way, everything was done here. Everything was just a posterior glide. Now, if you're going to be pushing more on the lateral side, just sliding it slightly over, okay? And then if you're on the medial side, going the other way, not on the tibial tuberosity necessarily, but a little bit more on the medial aspect of the tibia. Does that help, Jimmy? Okay, and if you look at the pictures in here,
I understand why he's doing it.
it's hard to tell with 66C, but you'll notice with 66D, he's kind of got his hand slid over a little bit more, trying to get over on this side a little bit. You just got to make sure you don't get too far over here and you slide off. Okay? Yeah.
Why are we externally rotating the tibia with flexion? I was a little confused with that. I know you said there was tightness in the capsule. I didn't know what that I mean, I understand mechanically how it changes it, but I don't understand why we're doing it.
Because of the screw home mechanism? Is that why?
Yeah.
Okay,
Yeah.
all right, that's what I thought you were asking. Okay. Well, mechanically, the knee goes from external to internal rotation, so it makes sense. I know what you're talking about.
Yeah.
You want us to go with flexion and medial rotation.
Yeah.
Absolutely. And that would be my first thought, too. But you're going to notice on some patients, when they flex their knee, they will tell you, you say, where does it bother? What do you think's holding you up? It's just like, they'll say, it's over here on this lateral side. I don't know what it is, but it feels like when I'm bending, there's a lot of pressure over here. So your tibia's got to be able to laterally rotate, too. So I will work on lateral rotation. And when we're in flexion, when we get in flex, we unlock our knee. Our tibias are constantly, our hamstrings are working to move them medially and laterally back and forth. So, you got to have that in a flex position to go laterally or medially. But I understand what your question was. Any other questions? Okay, so there's a couple of things that you can work on now. One, you can try the grade 3 traction on your belly. John's getting sleepy.